So in a lot of hospitals in the US and probably many other places in the world, when you walk in and tell your symptoms, there's an algorithm that tries to predict your likelihood of getting sick and then how much other tests you need. Seems very nice, right? The problem is Nature made a research last year and they found out that one of these algorithms used in millions of cases in the US is actually racist. So if I walk in a hospital as a white person with some symptoms, let's say my heart aches, and someone else, same age, same weight, height, everything, but it's black, has the same symptoms, then that algorithm is going to ask me to do more tests, and more likely it's going to ask that black person to just leave without further investigations. Sounds crazy. How did that happen? Well, because all these algorithms are trained on data. And who made this algorithm thought that the best indicator of how much I needed more tests was my spending. So they thought that people that spend more money in tests are the people that are actually more risky of having problems, because why should you spend money on tests, right? If you're healthy. Well, the issue is there may be so many other reasons why you spend more money on health, not because you need it more. It may be because you had different opportunities and you have the money to spend in tests while someone else didn't have the same opportunities and couldn't spend the same money in running medical tests. So this data was biased. The algorithms were built not in a careful way, I may say, and therefore they were biased. And so many people along the years have been hurt. Think about how many times maybe it happened that some black man needed some tests. The algorithm just thought that that person didn't because of the color of his skin, and maybe that person was actually sick and died. This is so crazy and it's so bad, and we need to be aware of this, because you see, we get so frustrated when you see violent images, people being killed just because of the color of the skin. But think about how many small cases of racism happen every moment, every time in the whole world, and we don't even realize. Even our computers are racist. That's crazy, and we need to have more knowledge about this and realize this and try to fix it. How can we fix it? Well, first of all, if we're not aware of these problems, then we are never going to fix it. Me as a data scientist, I swear to God, if I ever have to work on one of these problems, I promise you I'm going to do all I can to make sure that the data I'm using is not biased. That's what I can do. There's a bunch of other stuff, of course, but that's what I can do in my job to try to prevent these things from happening. In your case, you probably can be aware of this and try to open your eyes whenever you see one of these discriminations happening and try to take action so that they get fixed.